Hi, I'm Dr. Kim Bell, physical therapist. I am a specialist in dizziness, vertigo, balance problems, and falls. I own a private physical therapy practice, providing care in the home to people in San Diego County who are suffering with dizziness, vertigo, imbalance, or falls. And I'm pleased to be able to talk with you today about this topic of dizziness and vertigo. This is a special presentation that I created on behalf of the Rancho Santa Fe Senior Center in lieu of our in-person meeting, which was scheduled for June 24th. In an effort to contain the spread of the virus, we decided to present this topic to you online. If you are interested in further information about this topic, please let me know or let the Rancho Santa Fe Senior Center know, and we can schedule a follow-up presentation. If you have any questions directly for me after this presentation, you're welcome to contact me through my main website, betterbalanceinlife.com, which you can see written there in the blue. My mission as a healthcare provider is to rescue mismanaged and misunderstood people with dizziness, vertigo, imbalance, and chronic falls. My private physical therapy practice only accepts new patients with one or more of those problems, and we provide all the care in the home so that our patients don't have to ride in the car before or after their physical therapy with us, and they don't have to arrange a ride with somebody else if they're unable to drive. Today we're going to talk about these learning objectives. Of course, I could talk about dizziness and vertigo all day long, but I had to narrow the topic down to these learning objectives in order to have milestones that we can accomplish as we go through this presentation, and also to keep the time reasonable. Here are the learning objectives for today. We will differentiate between the terms dizziness and vertigo, learn how to track and report symptoms, understand how to manage an episode that occurs while lying down or rolling over in bed, learn how to manage an episode that occurs upon standing, and understand when to seek medical care and how to find a provider. First, we're going to start off with the terminology. It's really important whenever you are learning about a new subject to make sure you define your terms. Dizziness is the general term that the general public uses to describe what we as medical professionals may call dizziness, or vertigo, or disequilibrium. The general public uses the phrase dizziness for all three of those categories, so I'm going to define them for you now the way we define them within the medical world. Dizziness is more of a lightheaded feeling. That's the feeling you may have if you haven't eaten anything all day, or you feel dehydrated, or it's the feeling you may get right before you pass out. Sort of a lightheaded feeling is how we define dizziness. Vertigo, on the other hand, is a feeling that's associated with a false sense of motion. There's two times that vertigo can occur. Vertigo can occur when you feel like you're moving, but you're actually sitting or lying still. An example of that would be if you roll over in bed and you're lying in bed on your right side, but you feel like you're rolling in a barrel off the edge of a cliff. Another example would be if you lie back at the dentist and you feel like you're falling backwards through a black hole. That would be the definition of vertigo. It's a feeling of motion when you're otherwise sitting still. The feeling can be a rocking, a tilting, a rolling, or a sliding feeling. The other way that vertigo presents is with a false perception of otherwise normal movement. For example, if you're walking down the hall, and when I watch you walk, it just looks like you're walking normally, but you feel like you're walking down a flight of stairs into the floor. That's an example of vertigo. In order to complete this thought of the third thing that people may experience that they actually describe as dizziness would be disequilibrium. Disequilibrium means that you feel off balance, you feel unsteady when you're up, when you're walking, and sometimes even when you're lying down. If you want more information about the definitions of dizziness and vertigo, you can head over to vertigodetective.com. You can see this screenshot here. And this is a blog that I publish with free helpful articles in the form of blogs, and I'm going to point you to a blog for each learning objective today so that you can go online and read the information that I'm sharing during this video. You can find the definitions of dizziness and vertigo either at this blog called The Difference Between Dizziness and Vertigo, or by going to the glossary, which you see is circled there in the upper left, and then you can find the individual terms and read their definitions. That completes the first learning objective. The next learning objective we're going to cover is when to seek medical care. Sometimes dizziness or vertigo indicates a medical emergency, and it's really important that you recognize when you need emergency medical care for a new, sudden, severe onset of dizziness or vertigo, or for a recurrent onset that has these accompanying symptoms. I'm going to read to you from my blog, which is on vertigodetective.com. If you type the word emergency in the search bar there, you can pull up Vertigo Emergency What You Need to Know, and this will have all the notes that I'm about to read to you. Vertigo or dizziness can indicate a medical emergency if it accompanies any of the following symptoms: sudden severe headache, shortness of breath, rapid or irregular heartbeat, chest pain, neck or arm pain, double vision or blurry vision, numbness in your arm or leg, difficulty moving your arm or leg, which we call paralysis, facial numbness or weakness, slurred speech, mental confusion, fainting, or seizure. Those are all accompanying symptoms that, if they come along with a new severe onset of dizziness or vertigo, may indicate that you need emergency care. It is also recommended that you seek emergency care if you have any of the following symptoms with or without dizziness. If you're experiencing uncontrolled vomiting, you may need emergency care to get rehydrated. If you're suddenly unable to sit up on your own, stand, or walk on your own when you were able to do that before, then you may need emergency care, even if you don't feel dizzy. And if you have a sudden hearing loss or a sudden dramatic change in your hearing, then you may need emergency care with or without dizziness. That completes another learning objective, which is when to seek medical care as a vertigo emergency. If you want to read what I just shared with you, you can go to this blog, Vertigo Emergency, on vertigodetective.com and read that article. In keeping with this learning objective, I want to discuss why it's important to seek medical care, even if it's not an emergency. One of the reasons it's important to seek medical care from your primary care physician and any specialists that they recommend is because dizziness and vertigo can cause falls. And we know statistically that when people fall, they may get injured, seriously injured, like a fracture, or they may just get bruised, tear their skin, and these things can all cause pain, fear, and loss of independence. So we want to deal with the dizziness and vertigo in order to prevent falls. If dizziness and vertigo goes on for too long without proper care, it can trigger anxiety for people. With people that have existing anxiety problems, dizziness and vertigo can definitely make them feel worse, and it can cause anxiety for people who have never had a history of it before. Dizziness and vertigo is very interestingly linked to anxiety, because sometimes anxiety causes dizziness if people hold their breath or if they breathe too fast. Dizziness and vertigo can also trigger or worsen anxiety if they go unaddressed. Dizziness and vertigo can also cause depression for people. And we know that it's important to reduce anything that can contribute to depression as people get older. That's another reason it's important to seek medical care for dizziness and vertigo. Other consequences of unaddressed dizziness or vertigo include being unable to exercise, to stay strong, and less fun in life. So for all those reasons, it's important to seek medical care. Even if the dizziness or vertigo you experience is not necessarily a medical emergency, it's still important to report your symptoms to your primary care doctor and follow up on any referrals that they make for you. It's important for people to figure out why. Why do you feel dizzy? Why do you have vertigo? That's the question that I really emphasize with my patients. That's why the first visit I have with my patients is called a root cause analysis, where we look at their medical history, the onset of their dizziness and vertigo symptoms, and we do a very extensive head-to-toe exam to answer the question of why. Why are they having dizziness? Why are they having vertigo? And why are they having balance problems or falls in the case of my patients? A lot of times what happens when people seek medical care for dizziness or vertigo is that they're given pills to take that mask the symptoms. These pills all have side effects, and interestingly, one of the most common side effects of medication that's prescribed for dizziness or vertigo is dizziness, believe it or not. And so these medications can contribute to falls because they actually can cause dizziness, drowsiness, or blurry vision as side effects, and they don't address the underlying problem of why, therefore leaving the person likely with a residual balance problem, even if the symptoms of dizziness or vertigo are no longer a problem. So the approach that I like to take and that I advocate for with all my patients is to take a look at the symptoms, then figure out the underlying problems and look at the root causes. You can help your provider by making a note of your symptoms. You can use a journal like this gentleman is showing here. And this is the next learning objective we're going to cover. How you can help your healthcare provider by tracking your symptom onset, trigger, and duration. Those are really the three pieces of data that I would need or another healthcare provider would need in order to properly analyze your symptoms of dizziness and vertigo. We need to know, when did this symptom occur, what might have been the trigger, and how long did it last. Other symptoms that are important for you to track would be any change in your hearing, like ringing in your ears, loss of hearing, roaring sounds, rushing sounds, anything related to hearing that comes along with the dizziness or the vertigo, and any headache that you may also experience with the dizziness or the vertigo. You can also use a smartphone if you have one, or a tablet to track your symptoms if you would prefer to do that instead of tracking it on paper in a journal format. And if you want more information on this learning objective of how to track and report your symptoms, you can head over to vertigodetective.com. And now remember, detectives analyze evidence. And so the title of this blog is Vertigo Evidence and Analysis. And so if you type the word evidence into the search bar there, you'll be able to pull up the blog that I published on how to track and report your symptoms. And that completes our next learning objective. For the next two learning objectives, which are how to manage dizziness with sitting up or standing up, and how to manage dizziness with lying down or rolling over, I'm going to take the role of more of a health coach to share with you what I tell my patients that are having those problems. So for dizziness when you sit up, one of the things that's important is to hold your head still if you feel dizzy when you first get up. And the technique that I teach my patients is to use what I call calf pumping action. What this means is to keep your toes planted on the floor and lift your heels off the ground as you're sitting on the edge of the bed. You can lift both heels at the same time while you're sitting down, or you can alternate lifting one heel at a time. This may or may not be safe for you to do while you're standing. I definitely recommend for you to hold on to something sturdy like a table, a counter, or a chair if you choose to lift your heels after you stand up, and definitely alternate one heel at a time if you lift your heels after you stand up. But do that with some amount of caution because it may not be safe for you to lift your heels up while you're standing, but certainly most people should be able to do this if they sit up at the edge of the bed and get dizzy. And this calf pumping action will help pump the blood back up from your ankles, your feet, and your lower legs up into your body and bring the blood back to your heart, which is typically one of the main causes people get dizzy when they get up. This is also something that a physical therapist can work with you to manage. If you want to learn more about what to do about dizziness when standing, you can read the notes that I published at vertigodetective.com. Type in the phrase standing up in the search bar, and this blog will come up. Dizziness when standing, what to do about it. And I talk about the calf pumping action in that blog along with a few other tips. That completes the next learning objective, what to do if you get dizzy when you stand up. Another learning objective we're covering today is what to do if you get dizzy when you lie down or roll over in bed. And there's two answers to this learning objective. The first one is to avoid the position for the short term. So prop up on at least 2 pillows to avoid the dizziness you feel when you lie down or roll over in bed. If you want to review the strategies that I recommend for avoiding dizziness lying down and rolling over in bed, you can go to this blog, which is on vertigodetective.com. You can type in the key phrase lying down and hit the search button, and this blog will come up for you. It's called Vertigo with Lying Down or Rolling Over. And in this blog, I talk about propping yourself up on pillows to avoid the dizziness you feel when you lie down or roll over. I also describe a technique that I call the active resting technique, which you can use anytime you get dizzy, no matter what position you're in. And in that technique, you'll keep your head still, keep your body in contact with your supportive surface, like feet on the floor, hands on armrests, or laying in bed, and then you'll breathe through your nose to relax. So all that detail is in this blog called Vertigo with Lying Down or Rolling Over on vertigodetective.com. The second answer to what to do about dizziness and vertigo with lying down or rolling over is to discuss the most common inner ear problem. This inner ear problem is called benign paroxysmal positional vertigo, BPPV. This diagram right here shows the position of the inner ear. And this is a close-up of the vestibular system, which is our inner ear balance system. This is a diagram provided courtesy of the Vestibular Disorders Association at vestibular.org. And this shows you, if you look down at the very bottom, that clump of crystals, that shows you the crystals that can get displaced in the vestibular system when you have BPPV. That stands for benign paroxysmal positional vertigo. And what that means is it's not a disease or a pathology, and it comes and goes, meaning paroxysmal, and it's positionally triggered, meaning you lied down in bed, you rolled over in bed, you bent forward to put your shoes on, you leaned back to look in the upper cabinet, you turned quickly to talk to somebody. These are examples of positional triggers for the vertigo. The feeling of movement or spinning usually lasts for less than a minute. And the reason these crystals are down here where you see the close-up of the otoconia displaced from the utricle is because they're supposed to be in that organ right in the center of the diagram called the utricle. And through sometimes just normal aging of the membrane inside the utricle, the crystals come loose and they float around in those canals, most commonly found in the posterior canal. That's what BPPV is. It's the most common cause of positional vertigo that's caused by the vestibular system, which is the inner ear, and it is due to normal aging of the vestibular system. Here's an important thing for you to know. Simple BPPV, which as I described is a very common cause of dizziness or vertigo while lying down or rolling over in bed, it can be resolved in 1 to 2 sessions of treatment about 85 to 90% of the time. Because of this excellent result, when you find a skilled provider, this type of treatment for BPPV is considered one of the most clinically valuable treatments available in modern medicine today. Once the BPPV is resolved, meaning the crystals have moved back to where they came from in the utricle through treatments by a skilled vestibular healthcare provider, there is a rate of recurrence which is about 35% for the general population. If the positional vertigo comes back, it's important to seek out care again to get it resolved again. Here are some common positions that may cause dizziness or vertigo in addition to lying down or rolling over in bed. And if you get dizzy while you're leaning your head back to put in your eye drops, for example, you may have BPPV. If you get dizzy when you lean back at the dentist in the dental chair, you may have BPPV. Many people that I meet with this condition have never been diagnosed with it before and have seen all kinds of doctors, including specialty doctors such as ENTs or neurologists. Some of them have even gone to physical therapy, and no one has identified so far that they have BPPV in a lot of cases. Very many people that I see who are suffering with dizziness and vertigo turn out to have BPPV, and they never knew it, no one identified it, and one of the reasons is because it doesn't show up on an MRI. So here's important information in terms of advocacy. A lot of people are familiar with physical therapists. The general way to understand what physical therapists do is that we improve the way you move. You may have worked with a physical therapist if you had a back injury, or you had a knee or a hip replacement, or if you were in the hospital at some point. And there are general physical therapists that can provide that kind of general care that any new graduate should be able to offer when they come out of physical therapy school. I want to let you know that within the field of physical therapy, there are what are called vestibular physical therapists. That's what I am, and the physical therapists on my team are. And we specialize in working with people with falls of unknown cause, balance problems, dizziness, and vertigo in order to resolve those complaints. I want to let you know that one study found 80% of patients with falls of unknown cause had symptoms of vestibular problems when they were tested. So what that tells you is there's a lot of people who are having vestibular problems that don't even know, and that may be the reason why they're falling. Maybe they're on medication, so they're no longer feeling dizzy, but they're still having problems with their balance because the root cause was never addressed. Another study found that vestibular rehabilitation exercises, which is what I prescribe to my patients and what I do with my patients, they can improve walking and balance in older adults, even in the absence of inner ear problems. So say, for example, you've gone to physical therapy for your balance problem, for your walking, for fall prevention, and you haven't gotten any better. Well, the next step is to go to a vestibular physical therapist. The reason for that is because even if you're not one of the 80% of people in the last study I showed you that had vestibular problems when they were tested and they had had unexplained falls, even if you're not that 80%, say you're the 20% of people that don't turn out to have vestibular problems when you've had unexplained falls. Well, guess what? Look at this study. They found vestibular rehabilitation exercises improve walking and balance in older adults even if they don't have an inner ear problem. So that's the important information I wanted to share with you today about dizziness and vertigo. It's really important for you to know this information so that you can prevent a downward spiral. As I described, unaddressed dizziness and vertigo can lead to falls, anxiety, depression, lack of physical activity, lack of exercise, and just less fun in your life. So just as a reminder, it's really important to have a root cause analysis for your symptoms to figure out the root cause instead of just treating the symptoms to mask them. And if you want to find a provider who is specially skilled at vestibular care, such as myself, you can look at the website vestibular.org. This is where 1,500 vestibular professionals have registered with their business information, and you can search for a provider in your area who offers specialized vestibular care. The reason this is important is because this is a subspecialty within both medicine and physical therapy. So more general providers are not going to have the skills that you need for a full vestibular assessment, which could discover the root cause of your dizziness, your vertigo, your balance problems, or your falls. I have that website on this blog article that I published, along with a map of vestibular physical therapists across the United States. There's a link to that map and also a link to vestibular.org on this blog article, which you can find if you go to vertigodetective.com and you type in Vertigo Doctor in the search bar. Then you will come up with this article called How to Find a Vertigo Doctor in Your Area. And underneath that, I list vestibular.org as one resource, and I have a link to a map of the vestibular physical therapists that are registered on that map. So there's 2 resources that you can find to search for providers in your area. If you're interested in this topic, I wanted to let you know that I do have 3 lectures on UCTV that are available online. All 3 lectures combined have a total viewership of at least 500,000 views. The first lecture I offered was on preventing falls, and the second 2 lectures I've offered are on dizziness and vertigo, research in aging. So you can find those on the UCTV website, or you can find those linked on betterbalanceinlife.com if you go to my press page. I hope this lecture was valuable for you as we seek to ensure that your quality of life is good and you enjoy getting older, the golden years, so they call it, without suffering from dizziness, vertigo, balance problems, or unexplained falls. I want to invite you to contact me at betterbalanceinlife.com if you have individual questions, and I do offer a free 15-minute phone consultation to any new patients who contact me regarding their case, as long as they're in the greater San Diego area or plan to travel here for my care. If you're outside the San Diego area, I can send you an email with free helpful information. You can contact me through betterbalanceinlife.com. Again, it is my mission to rescue misunderstood and mismanaged people with dizziness, vertigo, balance problems, and falls. And I'm happy if this lecture may have accomplished that with you today. I believe we've met all of our learning objectives, and this is the end of the video. If you have further questions or you'd like a follow-up presentation, please let the staff know at the Rancho Santa Fe Senior Center, and I would be happy to present further information on this topic or a related topic at a future time.